I'm sure at one point in your life you have seen someone with this skin condition. So we'll just take a look at these few photos. And this is a condition that's present in literally all age groups, but it's mostly common between the ages of 10 and 30. This skin condition results from the loss of a pigment that gives your skin color. And the same pigment is the one that gives your hair color. It's usually common around the face. It can be your hands, your elbows, and sometimes around your genitals. In medical terms, this is called vitiligo, and it results from the loss of pigment that gives your skin its color. Now, the pigment that gives your skin the color is called melanin, and is produced by little cells that are present in your skin called melanocytes. Now, in this condition itself, something happens where this production is stopped, is deranged, or something happens with it that you do not get your normal skin color. So this condition actually affects all races, but you will notice that the difference between black and white, like let's say you have it as a black person, it will be more pronounced than it will be in a white person. So it seems to be more serious in blacks, but it's literally the same thing. So what really causes this derangement in this production of the melanin? So mainly here we'll just classify them into two parts. There's a lot of things, but for this discussion we'll focus on two. Mainly we call this autoimmune in medicine. So it's a situation where your own body starts to fight against your own cells and then starts to create problems. The cause, like all autoimmune issues, are very difficult to establish. So simply, your cells that are supposed to be fighting infections, we call them the T cells, start affecting your melanocytes, the cells that are producing the melanin, and they start reducing them in number, meaning your melanin will start to reduce and then you start to turn white. Other causes that have been shown to be linked to the development of this condition is trauma to your skin. So where you're unaffected, but with a recent history of trauma, you get to develop it. And then another is exposure to certain chemicals like phenols. And when it comes to the risk factors, if you have a history in your family where you have these autoimmune conditions, things like SLE that fights your own body, you are more likely to develop this same condition. And also genetics. If you have someone in your family, especially your parents, who had this same condition, you are more likely to develop it. So what are the signs and symptoms of this same condition? Simply nothing. When it comes to what you're feeling, no pain, no itchiness, no nothing. It's just a skin change that happens, but everything remains the same. The biggest part of this condition is a stigma that comes around it, and that's the main reason why I chose we should discuss it. If you were to take a look at a person with this condition, we always have that second look where we try to see, like, did you really see what you saw? And you're trying to ascertain to say, like, what really is that? And many people will think as if maybe the person got burnt or something, and you kind of distance yourself away from them. And that's mainly the reason that I chose to do this video, because these people, literally, you have this condition, is like you're a normal human being. It's just that your skin has developed this condition that is making you look different. And many people think as if it's supposed to be like so pronounced, but certain people on your own skin, you've got small patches like that, and they are different. Some people develop them to the full extent, and certain people will just have them in smaller patches, and certain people will just have them in certain particular areas. It affects us all differently, but some, it hits them more. And when it comes to the treatment of this condition, please get me correctly. You do not cure them, but you can treat them. And by treating, I mean you can delay the progression, or you can actually reverse this process, but you're not taking out the root problem itself. So what you can do is that you give drugs like steroids. Steroids reduce the inflammation in the body. So those cells that are fighting those melanocytes of yours, so like your own cells, the ones that are supposed to be fighting infections, will stop fighting those melanocytes. So they will have this sort of period where they're not progressing the disease. So that's what treatment means in this context. And in certain people, the skin can actually resolve to go back to normal. But remember, you have not taken away the actual problem. In other setups, you can be exposed to narrowband UV light, so which literally acts to take back your skin to normal, or delay the exposure. And there are new medications like JAK inhibitors that are being produced now that have been shown to have a good outcome. And another thing that's even more manageable in our setting is that you can be eating foods that are rich in antioxidants, things like the green vegetables. So remember, this condition has to deal more with the stigma that is coming towards a person with this condition. It's not contagious. It's not going to go away completely. So treat these people like the way you would treat a person of a different race, because literally what they have different is just a different type of skin.